Simone is here today, and she's a beautiful young lady who has some evidence of sun damage, but her biggest problem is a little bit of pigmentation, which is blotchy. This can be caused just from some exposure. It can be caused from hormonal changes, whether it be birth control or just hormone imbalance in the patient, as well as some medications or pregnancy. So our goal today is not necessarily to treat her very aggressively for wrinkles, but mostly to try to address the pigmentation. The nice thing about this laser is that it treats pinpoint areas of skin randomly in a way, and I'll show you a picture later, to cause a column of heat that penetrates down into the skin, removes that dead cells, the pigmentation in the skin in that one column, but there's enough normal skin around it that within a few hours it heals up. So there's no oozing, there's no crusting, there's no bleeding. You get an initial swelling and redness which occurs pretty much instantaneously, which lasts the first day, and then by the next day you're getting like a bronzed, like almost suntan look. And then in maybe 10 to 15 days, if you rub your hands on the skin, you may feel like a little grainy, like fine grains of sand. That is those little columns of skin that are moving out. We can treat any part of the body, the face, neck, chest, the back of the hands, essentially anywhere that the patient wants to be treated. We can treat all skin types, whether it be light colored skin to skin of color.
The first step is to apply the numbing lidocaine.
So Simone's been in the office now for a good hour and a half or so. We had a topical anesthetic applied to her skin. Most patients do require, for sure, some topical anesthetic because although the Fraxel laser is not super painful, it does create some heat, and in order to get a proper treatment, we want to try to increase the energy as much as possible. So by putting on some topical anesthetic ahead of time, it gives us an advantage. So we had removed, as you saw previously, the topical anesthetic, and now we're putting on what we call a tracking gel. It allows the handpiece of the laser to move freely on the skin. So here we have the handpiece, and this basically is where all the energy comes out of. We put the tip on, and this tip here has special rollers that roll across the skin, and you can see the red beam, and that's basically where the laser energy is going to come out. You look over here on the screen, we have various different settings. We have an energy that can go as high as 70 joules and as low as 0. The area that we're going to be treating today will probably be in the range of about 20 joules. The treatment level is what we control the density of the little spots. If you think of it, and I'll show you the diagram, these are little spots that are going into the skin. So we'll treat at an energy treatment level of about 8, and the number of passes that we'll do on a specific area is going to be 8. And all of this basically gives us the parameters that we want. The depth of each little pass is going to be about 800 nanometers, or a little bit less than a millimeter in depth. What we're going to do now is we're going to measure the amount of surface area that she has on her skin, on the face, and you can see the computer of the machine allows us to do so. So we're going to measure the length initially here, and this is not going to be painful. This is just to kind of calibrate the amount of energy that we're going to need in order to complete the treatment. We do that by grabbing the skin here, putting a little tension behind it, applying the handpiece here, and slowly pass the handpiece across the face. It gives us about a length of about 13. Now we're going to switch to the width. We're going to do the same thing here. We're going to measure from the side of her face centrally, and that gives us about a total area of about 218 centimeters. So in order to treat her at this energy level, we have an estimated amount of energy of about 4 kilojoules that we're going to treat. And as we go along, you'll see that the actual kilojoules will start to advance, and that's what's going to determine the amount of energy we've done on this treatment level. We use this machine here, which is called a Zimmer. Basically, it's like a giant refrigerator or air conditioner that blows a column of cold air that the patient can maybe help me by holding it in the areas that we're going to treat. It's a good way to distract as well as to minimize any type of heat discomfort she may feel. We're going to begin the treatments here on the side of the face, and she'll start to feel a little bit of like little pinpricks of heat. How does that feel, Simone?
So far, so good.
She had the topical anesthetic on for a few hours, about an hour and a half, so she really should feel minimal discomfort. If we treat higher energy, she may feel a little bit more, and in some of those patients, we need to give a little bit more of a type of oral medication, whether it be a small amount of Valium or a small amount of painkiller to try to help the patient through. Certain areas of the skin are going to be more sensitive, such as the areas around the eye. You can see that we do 2 passes, one going in the up direction, and then go ahead back in the same place, going back. And we try to cover the entire skin surface in a very controlled, even, slow pace so that we minimize the discomfort and get the maximum treatment. And you can see that our actual kilojoules is advancing as we move forward. Now we're going to do the upper lip area here. You want to hold the handpiece perpendicular. Make sure you get the entire area. You may not want to blow that up your nose because it doesn't feel very comfortable. And we want to go on to the surface of the nose. This particular laser is great for pigmentation. It's great for fine wrinkles. It's excellent for acne scars. And like I said before, we can use it on any skin type. I want to make sure that we get the entire cosmetic area, so even underneath the nose here we want to do, because we want to leave the skin totally normal. So now we've done one pattern going in that direction. We're going to do the same thing, but now go in the opposite direction to make sure that we get good cross coverage of the entire skin surface. Under the eyes, we can treat a little bit more aggressively or less aggressively depending on the patient's need. It's an excellent way to get that fine crepiness off the eyelids. For some of those patients that have extreme sun damage and a little bit deeper wrinkling, we have the more aggressive type of treatment called the fractionated CO2, which in concept uses the same principles of energy, but it's a little bit stronger and goes a little bit deeper. But that does give you a little bit of a downtime, so we have to have the proper patient selection. As you can see here, I'm methodically making my way across the face. We try to do cosmetic units all together, and then we'll switch to a different area of the skin. Open your mouth slightly. You want to get right to the crease of the mouth. You want to work on all the pigmentation and all the fine lines. We're going to go across to the midline of the chin. You want to go down over the jawbone and go a little bit underneath the chin, because you don't want to have a cutoff that's obvious in the way the patient's skin looks. So we go a little bit under and try to feather it in for the entire treatment. How are you doing down there, Simone?
So far, so good. Thank you.
Again, this is like a medium treatment. It's not super aggressive, but for the type of skin pigmentation problem that she has, it's probably going to be perfect for her. Usually it requires anywhere from 4 to 5 treatments, because, like I said before, the handpiece randomly treats about 20% of the skin surface. So in order to get the complete 100% surface, we would need to do about 5 treatments. Every time we do a treatment, however, the patient appears as if the entire skin surface is treated, because the entire skin surface appears red and gets slightly swollen. Again, certain areas of the skin are going to be a little bit more sensitive, especially right here in the temple. Areas on top of the bone, like the forehead, tend to also to be a little bit more sensitive. But she's doing great with the Zimmer and the topical anesthetic. She's tolerating the procedure really well with very little discomfort. After the treatment, we try to give the patients a little bit of a cooling mask. We have them try to strictly avoid the sun, because anytime you do any type of laser treatment, if you have a lot of sun exposure, we can get what we call post-inflammatory pigmentation, which is obviously what we're trying to eliminate here, so we'd hate for her to get any of that. So we try to make sure they use a good sunscreen on a regular basis, whether they're going outside or not. The ultraviolet light can penetrate through your car window, can penetrate through the window of the buildings that we live in. Certainly if you're driving to work or going out to walk the dog, that little bit of sun is enough to create problems. So we want to make sure that she is well protected. Fluorescent lights in offices, sometimes computer screens, can also create some UV or ultraviolet irradiation, which can then lead to pigmentation. So it's essential that patients basically wake up, brush their teeth, wash their face, and apply an adequate sunscreen every day. We're basically done with the lower portion of the face, and now we're going to start working on the temple areas and the forehead. Like I said, the areas of bone along the jawline and on the forehead tend to be a little bit more painful, but she's doing great. The machine is quite simple. It has a lot of gauges to help you control. It's almost impossible to make a mistake. The only way that you could do something that would not be beneficial to the patient was if you did too many passes and you kept going over and over the same area. Then you could create a little bit of heat damage, and that's something that you'd want to avoid. But if you keep track of your kilojoule marker here, you can see that our estimated kilojoules was 4, and I'm at about 3. I still have one more pass along the forehead, a little bit on her eyelids, and I think we're going to end up exactly what the computer generated as the energy that we needed to do to successfully treat her. The sensation is a sensation of heat, and maybe a little bit of prickling, kind of like a static electricity shock. But once we stop the treatment, it's just a little bit of heat and a little bit of swelling, and really patients don't complain about pain after the treatment. It's really a little bit of discomfort during. I've had really nobody that has been unable to complete the treatment because it's been that uncomfortable. There's no danger at all of going on the eyelids. There's no danger with this particular laser of going over the hair areas. This is not a laser that's going to create hair removal, and patients have been happy. The nice thing about it is that she could put her makeup on and go to work today if she wanted to. She'll be a little bit swollen, but certainly nothing that's going to keep her from looking beautiful. And tomorrow, take a shower, do everything like normal. There's no reason to worry about any bleeding or crusting or oozing or anything that would give her some discomfort or inability to be able to function at work. So we've essentially completed the treatment for today, and then Joanna, my esthetician, is going to come in and do a little cooling mask treatment so that the patient's more comfortable. Thank you.
Thank you, Dr. Zayat.